Hi guys, it's Sarah. Today I'm going to be talking about chapter 12, pages 268 to 271. So this chapter dealt with psychoactive dietary supplements and over-the-counter medications. So I started off the chapter focusing on the different types of dietary supplements. The first one the chapter talked about was St. John's wort. The botanical name for this is Hypericum perforatum. It was also once known as the devil's scourge because it was supposed to prevent possession by demons in its past uses. Now it's used to treat anxiety and depression, but there are limited studies that provide evidence it improves anxiety, although some studies have suggested it does treat depression. But the FDA is concerned about its interactions with other prescription medications. SAMe, or S-adenylyl L-methanone, is an active form of amino acid methanone, so it acts as a methyl donor and is approximately as effective as prescription antidepressant medications. Then there is ginkgo biloba. This has a long history of medical use in China, and it's also known to reduce blood clotting. So for this reason, it cannot be combined with aspirin and other blood thinners, but it also is known to possibly improve memory for people suffering from Alzheimer's disease. Okay, and then the chapter went on to talk about weight control products. So the first product it mentioned was Herbalife. This was one of the first makers of dietary weight loss products. They began in 1980, and most of their original products contained Mahou, which contains ephedra. It's an amphetamine-like stimulant, and it was later banned by the FDA. So now their products rely on large doses of caffeine in order to replace the ephedra. Okay, and then the chapter went on to talk about over-the-counter drugs. So over-the-counter drugs are drugs that are self-prescribed and self-administered. It's estimated that consumers self-treat themselves 4 times more than health care providers do using OTCs. Americans spend over $18 billion a year on OTC products. And then the 2 biggest OTC markets are aspirin-like analgesics and collection of cough, cold, and flu medications. The last part of the chapter I looked at was the FDA regulation for OTC products. So in 1962, the Kofavir-Harris Amendment was passed, which required that all drugs had to be evaluated for their safety and efficacy. So the FDA decided that it was too much to study just the individual products themselves. So instead, they're going to review the active products or the active ingredients in these products. So OTCs are divided into 26 different classes, and then each class has a special advisory panel that looks at the active ingredients, if they're safe and effective, and then they make claims for the label. So a couple of terms that are used by the FDA include GRAS, which stands for Generally Recognized as Safe. It's used by the FDA to mean that given the available information, the people who are informed and qualified agree that it is safe to use. And then SAFE is referring to a low incidence of adverse reactions or significant side effects under adequate directions for use and warnings against unsafe use, as well as low potential for harm, which may result from abuse. And then GRAY means generally recognized as effective. So effective is referring to a reasonable expectation that in significant proportion of target population, the pharmacological effect of the drug under adequate directions for use and warning against unsafe use will provide clinically significant relief of the type of relief it's supposed to or claimed to do. And then the final term that was used was GRAL. So this is generally recognized as honestly labeled. So this just means that the label is portraying what is being sold. So each ingredient is determined to be either a GRAS, a GRAY, or neither of them. And then which more information may be needed to determine whether the FDA can approve the product or not. All right, thank you for listening. This is, again, Chapter 12. Hope you guys had a good weekend, and I'll see you next week.